Good afternoon, class. In this recording, we're going to continue looking at some GU alterations, and we're going to focus specifically on urinary problems associated with infections, inflammation, and obstructions. So our focus conditions are exemplars, which represent inflammation and infection, are urethritis, cystitis, and pyelonephritis. Typically, when we see the itis on the end of a word, we should think of inflammation. We can have inflammation without infections, but we do not have infections without inflammation. Signs and symptoms of inflammation and infection can be pain and redness and exudate, leukocytosis, malaise, fatigue, spasms, and cloudy or bloody urine in this instance. So our first condition listed here is urethritis. It's an inflammation of the urethra, commonly associated with sexually transmitted diseases, although not always. We see it oftentimes in men that have gonorrhea and chlamydia infections. With women, sometimes we see it with feminine hygiene products, perfumed toilet paper, spermicidal jelly, or urinary tract infections. And so we see it, though, as well with sexually transmitted diseases. With urethritis, we want to obviously try to get to the root of the cause and treat that. Avoid it if it's something that's just causing it to be inflamed, such as the synthetic underwear or whatever. We want to encourage fluid intake. If we suspect it is a sexually transmitted disease, then they need to be tested for that. So avoiding chemical products and sex during the time of the problem is important. And if indeed there is an infection, then antibiotics may be prescribed. With cystitis, we got inflammation of the bladder from an infection, an obstruction of the urethra, or other irritants such as an indwelling catheter. Wearing a wet bathing suit for a long time can lead to cystitis. Certain soaps, bubble baths, sexual intercourse sometimes can lead to it. Synthetic underwear and pantyhose as well for this condition. But most commonly we see it associated with bacteria from E. coli. So cystitis is commonly termed a urinary tract infection. So it's an inflammation of the bladder. Signs and symptoms include frequent urge to urinate, pressure, dysuria, urgency. The urinalysis will be tested and will show sometimes the organism. It'll show increased leukocytes. And so, we would culture it and treat it accordingly. I've got this slide right here on cystitis, preventing cystitis. Drinking 8 to 10 glasses of water a day. So staying hydrated, wiping from the front to the back if it's a female, avoiding any vaginal deodorants, bubble baths. Always urinate after intercourse. That's a good practice. Douches can also contribute to this. And the treatment, typically, if it's an infection, involves an antibiotic. Pyelonephritis is our next condition. It's a bacterial infection of the kidney and renal pelvis. Key features are listed. We see fever, chills, tachycardia, tachypnea. They oftentimes have flank pain. Nausea, vomiting is quite common. General malaise and fatigue, and we see the white blood cells increase and a urine culture that's positive. With the elderly, oftentimes we see changes in their mental status. With this condition, it can be acute or chronic. Chronic is a slow, progressive disease associated with recurrent acute attacks causing contraction of the kidney and dysfunction of the nephrons. And it can lead to kidney failure. So with all these conditions, there's a variety of drugs that may be prescribed. We may see urinary antiseptics, antibiotics, analgesics, antispasmodics, and so forth. Key for the therapy as far as the drugs is to make sure they continue their course of drugs with their antibiotics even when they're feeling better. Nursing care for these urinary conditions, if we don't treat these conditions with antibiotics, they can lead to sepsis, shock, and death. So prevention is important. How do we prevent some of these conditions? Strict surgical asepsis when we're inserting a Foley catheter. And I encourage you all to go online and look up the term CAUTI, C-A-U-T-I. CAUTI is a movement to prevent nosocomial infections caused by hospitalization with Foley catheters. So we want to be sure and leave these catheters in as the fewest days possible. We want to use strict surgical asepsis. And I encourage you again to look up that term and learn a little bit about that, because there's lots of other strategies that can be implemented for prevention of urinary infections. We want to maintain hydration in these patients. Flush the kidney out by letting them urinate frequently. Again, they want to complete their antibiotics, and so your role is education, strongly into education with these patients. So as you're educating the patient, you may want to tell them to drink 2 to 3 liters of sugarless fluid a day, get plenty of rest and nutrition. Again, clean the perineum from front to back. Avoid using or wearing irritating substances such as bubble bath, nylon underwear, and scented toilet paper. Wear loose-fitting cotton underwear, loose-fitting pants also. Avoid the use of scented or flavored lubricants. Wash the perineum after intercourse and urinate after intercourse. Empty the bladder as soon as they feel the urge to urinate. Empty the bladder every 4 hours. Cranberry juice, apple cider vinegar, vitamin C, some of those things have been shown to help. Those are home remedies. And again, take the full course of antibiotics. The next conditions we're going to look at are obstructive conditions. We're just going to look at urethral stricture and urethrolythasis or nephrolithasis, or stones is an easier word to say. There are some other urinary obstructive conditions we're going to cover when we look at male reproductive in another recording. The first condition I want to talk about is a stricture. Now this is a picture of stones, but a urethral stricture, this is your urethra here. So anything that presses against or twists or whatever with this urethra is going to, or a narrowing of that, is going to prevent the urine to flow. So a narrowed urethra is a urethral stricture. And the most common symptom we see with that is obstruction of the urine flow. Surgical treatment is required. It's the best chance for a long cure is a urethroplasty. There is a temporary dilation of the urethra that's done to temporarily fix that. And if that can't be fixed, then a nephrostomy to divert the urine to the outside may be performed. Now we're going to talk about calculi. Stones anywhere along the urinary tract can occur. So you can see here we've got the kidney stones here, and that's the term nephrolithasis. or we can have stones in the ureter, and this is the term urolithiasis. Causes of these include family history, a diet high in calcium, vitamin D, milk, protein, oxalates, purines, and alkali. We see stones sometimes in people that are dehydrated, people that are taking diuretics, people that have prolonged Foley catheters, immobilized, people that have high calcium levels or hyperparathyroidism, or gout sometimes. We see it more in males. The symptoms, oftentimes the patients will have nausea, vomiting, they'll have agonizing pain, sharp, sudden, severe pain as it moves, so it may be intermittent depending on the movement of the stone. Hematuria, or blood in the urine, is a common occurrence. Painful urination and urinary frequency. Stones are typically diagnosed with an ultrasound or an IVP or the other test listed here. Risk factors for kidney stones or urethrolysis include infection, urinary stasis and retention, immobility, dehydration, increased uric acid, and increased urinary oxalates. So I kind of repeated myself there, but I think this is a good little slide. Nursing care includes monitoring vital signs, maintaining intake and output, straining urine, making sure they're continuing to void, monitor and treat nausea, vomiting, monitor and treat pain as well, encourage a lot of intake to help flush the kidneys out, to move that stone on out of there, strain the urine with a strainer, warm baths and heat to the flanks sometimes are soothing, reposition the patient and encourage them to ambulate because you want to get that stone out of there. Also, depending on the composition of the stone, there are certain diet modifications that are called for. Lithotripsy is another is a medical treatment, a surgical treatment strategy. It's very common, and so what we see is a sound, laser, or dry shock wave is used to break up the stones in small fragments. The patient goes under conscious sedation to have this done, and topical anesthesia is applied to the skin. It's real important with lithotripsy that they have a continuous EKG going because we're worried about arrhythmias. This procedure can lead to arrhythmias. When they come back from having this done, they will have a catheter, and most likely the catheter will have some blood in it. And we may see some stone fragments in the bag. They also may develop some bruising in the back. This concludes this recording on urinary problems. I will pick up on another recording. Thank you very much.